Today we're diving into a real mystery out of Minnesota, where a program meant to help kids with autism just exploded into a $343 million situation. Seriously, it's a story that starts as a public health success and kind of morphs into a true crime thriller. And it leaves us with this huge question. How do you balance providing care, managing costs, and making sure nobody's gaming the system? Let's get into it. Okay, so the whole story really starts with this one just staggering number. In 2024, Minnesota's Medicaid program is on track to pay out $343 million for autism services. And to really get your head around how massive that is, you have to see where things were just a few years ago. Just look at this. I mean, really look at it. In only 7 years, spending shot up from about $1 million to over $300 million. That's not just growth, it's an absolute explosion. And that right there is the core of the mystery we're going to unpack. So the big question is, how on earth is a 30,000% jump even possible? Well, the answer is complicated. It's a mix of a genuine, growing need for these services and, well, an opportunity that turned out to be totally irresistible to criminals. But before we get into all the fraud and the chaos, it's so important to understand why this program even exists. You see, this whole spending boom was actually built on a very real and growing need for care. The program at the heart of all this is Minnesota's EIDBI. Basically, you can think of it as the state's main initiative for giving intensive early therapies like applied behavior analysis or ABA to kids on the autism spectrum. It was set up to help families, simple as that. And the demand for that help was just surging. According to the CDC, the number of kids diagnosed with autism shot up like crazy during this time. In just 5 years, the rate almost doubled. So way more kids were being identified as needing support, and programs like EIDBI were there to give it to them. But here's the thing. Whenever you have that much public money flowing that fast into one area, it can attract the absolute wrong kind of attention. And this system, designed to help Minnesota's most vulnerable kids, also became a giant magnet for massive organized fraud. Just think about the providers for a second. In 2018, Minnesota had 41 approved centers. Fast forward to 2024, and that number had exploded to 439. We're talking a tenfold increase in just 6 years. And investigators pretty quickly figured out that not all of them were playing by the rules. Now let's follow the money, because this is where it gets really wild. This table shows the reimbursements just taking off like a rocket. I mean, look at 2019, an 809% jump in a single year. Then boom, another 153% leap in 2021. This wasn't just normal growth, this was a gold rush. So you're probably wondering, how did they do it? Well, federal prosecutors laid out a whole playbook of fraud. Billing for therapy sessions that never happened, hiring unqualified staff, making up fake diagnoses, even paying illegal kickbacks for patient data. And get this, some of the same criminal groups were also tied to that infamous Feeding Our Future scandal, which stole $250 million from a child nutrition program. The scale of this is just hard to wrap your head around. The state's Department of Human Services, or DHS, hired a company called Optum to figure out what was going on. And the findings were just devastating. The report found that over 90% of the claims from these autism centers didn't follow program rules, pointing to a potential $703 million in overpayments. Okay, so with fraud this widespread, the state and the federal government, they had to act. But the crackdown, as necessary as it was, came with its own set of really painful consequences for the exact people the program was supposed to be helping in the first place. So in 2025, Minnesota's DHS basically dropped the hammer. They reclassified autism services as high risk. And that triggered a whole bunch of new rules. Mandatory fingerprint background checks, surprise site visits, and a complete freeze on new providers in over a dozen categories. They were trying to stop the bleeding, and they were trying to do it fast. And the effect was immediate. As soon as there was real scrutiny, dozens of these providers just shut their doors. 54 of them closed up shop voluntarily, and the state kicked out another 18. The provider industry started shrinking almost as fast as it had grown. But here is the really tragic irony. The crackdown created this huge collateral damage. And this quote, it just gets right to the heart of it. When you freeze payments to investigate fraud, you also end up freezing payments to the honest providers who are just trying to do their jobs. And this isn't just a concept. Here's the real-world impact. The Autism Society of Minnesota, a totally respected advocacy group, is now facing a $500,000 funding shortfall because of all these payment disruptions. And that threatens essential programs, like summer camps for kids with autism, programs that have absolutely nothing to do with fraud, but are now caught right in the middle of this mess. So let's zoom out for a minute, because while Minnesota's story is pretty extreme, it is not unique. What happened there is a powerful cautionary tale for the entire country, as states everywhere are trying to deal with the rising costs of autism care. Just take a look at the national picture. Yeah, Minnesota's spending is high, but they are definitely not alone. Indiana actually spends even more. Pennsylvania is around $600 million, and Florida's projected spending is in the billions. This is a nationwide trend for sure. But here's the thing that makes Minnesota really stand out. It's the growth rate. Right, Indiana's spending is higher, but its growth was about 2,000%. Pennsylvania's was high, sure, but it's still just a fraction of Minnesota's 31,000% explosion. That extreme rate of growth, that's a giant flashing red light for fraud. And all of this is happening while nationally the demand for ABA therapy just keeps going up. As more and more states start covering these services, which are effective but also very expensive, they all face the exact same challenge. How do you pay for the legitimate care while also building guardrails that are strong enough to stop the fraud that always, always follows the money? Which brings us to our final, really tough question. The Minnesota story shines a light on this painful dilemma. I mean, fighting fraud is absolutely non-negotiable, but aggressive crackdowns can totally disrupt care for innocent families. So the question we're left with is this. As we build better systems to catch the criminals, how do we also build protections for the patients who are caught right in the crossfire?